Yeah. Oh, you need it.
Hey, Gary?
Into, this is what it's showing everybody. How do I get to? Barely even getting me. It's confusing. I mean, that's why we just have like a person. But I don't know. I'll try it and if it works, I'll talk it over to you. You know, so, yes, yes. And that's what I was feeling. I'm a feeling. We're ready.
Okay, good afternoon. I'm Raul Garza, and I'm not the chair of this HR committee. I'm filling in for Chair Sorrell. So I'm calling the meeting to order, and I'll ask the secretary to call the roll of attendance.
Director Green? Here. Director Masuda Barnett? Here. Director Robinson?
Present.
Chair Sorrell?
Present.
And Acting Chair Garza?
Present.
You have a quorum.
Thank you, Madam Secretary. So we need a motion to allow Chair Sorrell to remotely participate in this meeting as a voting member. Do I have a motion, please?
So moved.
Thank you, Sam. Need a second?
Second.
Thank you. Thank you, Director Green. All those in favor, say aye.
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 All those opposed? Okay. Madam Secretary, are there any speakers registered to provide virtual or in-person testimony, or have they sent written testimony to be included into the record?
We have not received any registrations nor any written testimony.
Okay, thank you. We'll move right along to item 3A, which are the minutes of the May 16th, 2025 HR committee meeting. Those were approved by the board at the May meeting. So I'm going to ask if there are any corrections that are needed. So first I'll need a motion to accept item 3A, the Human Resources Committee meeting minutes of May 16th, 2025. Thank you. Have a second?
Second.
Thank you.
Second.
Is there any discussion or any corrections to be made? Okay, hearing none. All those in favor, signal by saying aye.
Aye.
Thank you. Any opposed? Okay, that motion carries. And then Dr. Makaitis had a conflict, so I'm joined by the Chief Human Resources Officer Win Buren, who will present his department's report.
All right, good morning, everyone. I'm Win Buren, Chief Human Resources Officer. It's my privilege today to open the HR committee meeting. I'll be sharing a snapshot of our workforce, our HR team structure, and the strategic functions that drive our success. My goal is to highlight not just the numbers, but the people, values, and priorities that shape our approach. After my remarks, you'll hear directly from a few of our HR leaders about their areas of focus and progress. At Cook County Health, our workforce is our greatest asset. Every day, more than 6,300 dedicated professionals, clinical and non-clinical, work together to fulfill our mission, providing high-quality, compassionate care to the residents of Cook County. As HR professionals, our role is to support, develop, empower this team so that they can make a difference for our patients and our communities. So let me share a snapshot of who we are as an organization. So we have over 6,300 employees with a strong clinical to non-clinical ratio. About 63% of our staff are in clinical roles. Our workforce is predominantly female and Black or African American, reflecting both our commitment to diversity and our connection to the communities we serve. The average tenure is 10 years, which speaks to our ability to retain talent and build institutional knowledge. We serve the second most populous county in the nation with 5.1 million residents across Chicago and its suburbs. I'm proud that our workforce reflects the rich diversity of Cook County. This is not just a statistic, it's a strategic advantage that helps us deliver culturally competent care and build trust with our patients. Next slide, please. Supporting workforce this size and complexity requires a robust HR structure. We operate as a centralized HR function with 68 budget positions, 63 currently filled. Our team includes 2 associate CHROs, directors, managers, coordinators, and specialists across key areas that include talent acquisition, classification and compensation, HR operations, HRIS and systems, workforce development, EEO, and operations council. We support all CCH sites, including Stroger, Provident Hospitals, the Core Center, Cermak Health Services, Public Health, and 15 community health centers. Our structure is designed for both efficiency and expertise. Each functional area is staffed by professionals who understand the unique needs of our workforce, and whether it's recruiting top talent, ensuring fair pay, or supporting employee development. HR at CCH is more than just hiring and payroll. It's a strategic partner in every aspect of workforce management. We have our classification and compensation team that ensures our fair pay and competitive pay, regularly reviewing job descriptions, salary structures to align with market trends. We have our talent acquisition team. That team focuses on attracting and hiring top talent with a strong emphasis on compliance and equity. HR operations, where we manage daily HR processes from onboarding and leave administration to payroll adjustments and record maintenance. And HR systems, where we leverage workforce data and analytics to drive operational efficiency and support decision-making. Organization and workforce development, where we lead onboarding, training, leadership development, and employee growth initiatives. Operations Council, our internal legal advisors, ensure we're compliant and protected in all employee matters. And Equal Employment Opportunity, where we investigate discrimination and harassment claims and represent CCH in external cases. Each of these areas plays a critical role in supporting our employees and advancing our mission. Our HR team is committed to operational excellence, compliance, and continuous improvement, ensuring that CCH remains an employer of choice. 2 areas are especially critical to our success right now: talent acquisition and organizational and workforce development. First, you'll hear from our Assistant CHRO for Talent Management, RJ Dabney, and Director of Talent Acquisition, Karen Hughes, who will share how we're attracting and retaining top talent in a highly competitive market. This includes our efforts to streamline recruitment, leverage new sourcing strategies, and ensure our hiring practices reflect our commitment to diversity and equity. Next, Assistant CHRO Carrie Premis-Volk and Director of Organization and Workforce Development, Janine Sergey, will highlight how we're investing in our people through onboarding, training, leadership development, and career pathways. These initiatives are designed to build capacity, foster engagement, and ensure that every employee has the opportunity to grow and contribute to our mission. Together, these teams are driving the progress that keeps Cook County Health moving forward. And with that, I'll turn it over to my colleagues to share more about their work and the impact they're making. RJ and Karen.
All right, good morning, directors.
Good morning.
I'm RJ Dabney, Associate Chief Human Resources Officer for Talent Management. Next slide, please, Karen. All right, I think we're still, there we go. All right. So these are a few of the areas that I oversee And I won't spend too much on this because Wynn just did a good job of giving an overview of most of our functional areas of HR. But class and compensation, HR operation and systems, as well as talent acquisition, that makes up the talent management portion of our HR department. We've aligned these core functions to attract, retain, and support top talent while ensuring compliance and operational efficiency. Class and compensation encompasses 3 FTEs. We have 14 FTEs in HR operation and systems, and 30 FTEs total in talent acquisition. Talent acquisition is going to be one of the focus areas that we'll deep dive in later on. As for HR operations and systems, they're essentially the backbone of our HR daily work. This team handles everything from onboarding contractors to payroll adjustments, and we'll take a deeper look at them next in the next slide. They're also key players in our compliance and accreditation readiness. Next slide, please, Karen. HR Service Link, which is managed by our HR operations team, is our self-service centralized platform where employees can submit and report HR cases such as employment verification, pay rate errors, grievances, and even benefit inquiries. This eliminates paper. It centralizes the filing processes. It's accessible 24/7. It's also very easily accessible on either public links or on our intranet. This is an overview of our HR activity report. So as of October 31st, our vacancy rate our total vacancies were 1,576. This is an improvement from 1,765 in the same reporting period last year. The vacancy rate decreased to 20.89%, down from 24% year over year. Despite an increase in total budgeted positions from 7,342 to 7,546, the number of vacant positions has dropped by 189, or a decrease of 10.7%, showing effective hiring and retention efforts. The agency conversion initiative last year added 224 positions, so this initially increased our vacancy rate, but we see this trend now reversing. We'll go over our key metrics. Most of this we saw just in our finance committee meeting just previously. So I'll focus mainly on our net hiring numbers. Again, this time last year, we were just at 255 net hires, and this year, year to date, we're at 445. So an increase of close to 75%.
Hi, good morning, everyone. So on top of the talent acquisition team's management of hiring permanent employees, we also partner with our graduate medical education team to bring in 150 residents every year. So with that,
I'm sorry, can you speak more?
Sure.
You can move the microphone so it's in front of you. There you go.
How's this? Good? Okay. Start over. So on top of processing permanent hires, our talent acquisition team also works with the graduate medical education team to onboard 150 residents every single year. With the 150 residents, they span various specialties, and in onboarding, we are doing their background checks, scheduling employee health service appointments, doing the fingerprinting, and also drug screenings and ID issuance. This is done in a short amount of time between May and July, and this is all to get them started on July 1st. Currently, we are working with quality assurance to work with improving the entire process to make the onboarding more efficient, streamlined, and the residents, happy with their experience.
All right, so we'll dive into our hiring metrics for RN specifically. So this is just emphasizes our hiring velocity and attrition trends for RNs. We've made 533 offers thus far, with 326 of those offers being accepted. There have been 152 external field direct care RNs in various direct care positions.
So with the current state of agency use for RN, we have seen a significant drop from September 2024, where we had about 498 contractors, to now 290 contractors in September of 2025. This decrease is due to the previous agency conversion initiatives, and we expect to see these numbers continue to decrease as we are working through the current contractor conversion. Right now, we are processing all of the CN1 contractors who have accepted our offers outside of ACHN. And for any of the vacancies that are left come November 24th, we will be reposting the positions via the accelerated hiring process to hopefully bring on CN1s at a faster rate. Beginning December 10th, we will be starting the ACHN contractor conversions for CN1.
So the reduction in contractors is a direct relationship to the increase in hiring that you're doing.
Yeah, there's a combination of factors. The earlier parts of the year, we did have some hiring events specifically for RN, so we had some success there, especially with new grad hiring. We're now in the midst of agency conversion, so that'll buoy the numbers as well.
So how does that information get shared with the staff? Because I know that we've sat in these board meetings, and there has been the occasional testimonial where one of the salient complaints is that we have too many contractors, and I'm sure you're well familiar with the tension around that, but that's pretty significant, like that kind of reduction in contractors, and I just want to make sure that I'm understanding the relationship between the reduction and what you showed a few slides ago, that the hiring and onboarding of new staff, which I thought was impressive as well.
Yeah, I think we can celebrate it more. We do try to share those metrics during leadership forums and other meetings and such, but to your point, we should probably highlight it much more.
That is the point, actually. Yeah. I think that would go a long way in people understanding what the data really shows that reflects the work that's being done. So, yeah, thank you.
Thank you.
Okay, may I ask a question? Looking at the current slide that you have up now, if we look at September FY 28, so that number is roughly around 280, 90, something like that, right? That's the number of contract nurses that we have currently. How does that number compare to the total of full-time RNs that we have?
I have to look at that. I believe we're close to, actually, let me get back to you on that.
Okay.
I don't want to miss quite. I know we have roughly 500 vacancies, but I need to know the total number of budgeted RNs we have.
Okay, so the point that I'm trying to get to is, and this is going with what Chair Garza mentioned, the issue that we've experienced over time. I've been on the board, I guess, around 3 years, and it's been an issue every year about the number of agency people that we have, which, no argument, the number's coming down, and it's coming down in a very good way. The question that I'm presenting is, earlier today, someone in the previous meeting mentioned we're almost reaching the floor. The question becomes now, what does the floor look like for the RN? I don't know if we're at that number, and I'm not suggesting that we are, but the question I'm saying is, if we can put that in perspective, where we need to reduce the agencies with the nurses to where it becomes beneficial for us to be able to operate versus the number that we have actually hired. so that we understand it. And also, if we're able to put something in, and it may be there already, but put something into our regulations where a agency nurse can only remain in place for so long before they must be removed, because this is not, an agency is not a permanent fixture. If you want to come, if you like working here at Cook County, then work at Cook County. Otherwise, you are temporary, and we need to treat you as such, meaning that you do not have a permanent residence here. You must be full-time, or you come in for a certain amount of time, deliver the services that we paid you for, and then you're out the door.
Yeah, to that point, one of the benefits that came out of the settlement agreement with NNOC is, we were to offer essentially every RN that's currently working here, and if they do not accept, there is a timeline that they must be demobilized. Before that, we are putting all of those vacancies through accelerated hiring, so even prior to them being demobilized, those roles would be essentially filled, and they'll be demobilized even before that timeline. So that's been communicated throughout the conversion process. Karen and her team worked hard on not only reaching out, but communicating that, the benefits to accepting, just because we want them to be members of our team full-time, but also the consequences of not accepting and being demobilized.
Excellent.
Yeah.
So in terms of the accelerated hiring process, which again we will be implementing for the CN1 vacancies, this essentially streamlines the recruitment process to shorten the selection. Essentially with AHP, how we expedite it is we post the position for a minimum of 5 days instead of 14 days. And we screen the applications to create a preliminary eligibility list based off of experience and skill set. From there, we have eliminated the interview stage, which greatly expedites the selection process, and offers are then extended based on the preference order, which is internal, veterans, contractor, interns, externs, and then external.
This next slide speaks to turnover here at CCH, which we are exceeding expectations across the board. So our overall...
Mr. Dowd, I just have a quick question before that. Is that okay? Okay. So I'm understanding when they sent the previous slide out, now instead of a 2-week posting for some positions, it would take that from 2 weeks to 5 days. The candidates would be able to apply to those positions?
During the external posting period, yeah.
During the external posting period?
Yeah, so the internal posting period still needs to follow the CBA
Got it.
guidelines.
Thank you.
Yeah. Okay, overall turnover here at CCH is 6.9%, which compared to national rates of 18.3%. We're doing a tremendous job of retaining our staff. Our RN turnover nationally is at 16.4%, and we're at 9.6% here at CCH.
That's a very significant
Absolutely.
difference. Yeah, congratulations.
Thank you.
The real question here is, you've definitely done a great job, but how do we take whatever we're doing here to attract more people in so we can fill the vacancy? That becomes the big question. Because if they're here, apparently they like being here, so that's great. So how do we now attract those others, which, at the beginning, I was waiting for this. I thought we were going to talk about it, but we didn't. Talent acquisition.
Well, while you're looking for that, I do have a statement. I mean, because you're not focusing on having to replace people to fill vacancies resulting from a higher turnover, you're able to focus more on new growth and new candidates, I would assume.
Yeah, absolutely.
Yeah.
And maybe to anticipate your question, Director Robinson, It's a good segue into our sourcing strategy. So just to be able to be, to attract more candidates, we have to be a little more proactive. Our past practice has been a little bit more of posting and praying as opposed to really prospecting and canvassing, not only, via LinkedIn or other job boards, but with a lot of our recruitment partners and networking with those specific associations and just the community partners as well. So we do need to tell our story more proactively as opposed to relying on website traffic. And so that's what what our future state looks like with our sourcing strategy. These are just a number of our partners, and some of these are specialty-specific job boards, and a lot of them are community partners that we work with as well.
Yeah, so this coming year, we are really just going to focus on our recruitment branding to really be able to tell the story, and also looking at different nursing programs, for instance, and building partnerships with them. This way, we can attend, hiring fairs, have it timed better where it's, close to their graduation. This way, we're able to offer them the role, and hopefully they'll join us. So I think it's just really taking more of that proactive stance and really focusing on creating a plan and executing it.
Okay, you are exactly where I was going. So this is fantastic. I like the way it's laid out here with talent management. My question is, staying with the same vein of where we are, if we were to ask you, and if we were to ask the nurses, why come to this organization? Do we have an answer to that question right now?
I think we do, with some folks that I've talked to at least.
They
And
do?
I will say that we've been partnering with the nursing leaders to attend different events. For instance, this past Friday, we had 2 recruiters join Trista and also Devanshi at the UIC Nursing Leadership Conference. And then we also have been partnering with them to attend Chamberlain's graduation day, where they do talk about the benefits of joining CCH. And some of those benefits are, there's so many different specialties here that they can really grow and gain a lot of experience across different focus areas. Also, with the mission itself, it really has a great impact on, drawing people to CCH and having that deeper meaning to join. And I think, I'll go to the next slide because I think this might help. We recently, this year, also implemented LinkedIn Recruiter, which is one of the largest professional networking sites in the world. We have our enterprise account here where we're able to actually focus more on that recruitment branding piece and giving the public more information around CCH. So for instance, we have built 2 life tabs, so basically life pages, one being about CCH in general, which talks about the mission. It has a video about what makes CCH so great. And then another page is actually about nursing specifically. We have been partnering with marketing and will be continuing to put more information on there, including testimonies from nurses. So there's a lot of work going into that recruitment branding piece. We also have 3 other life tab pages that we will build out, and we're able to switch it depending on the focus areas that we want to recruit for.
Okay. I'll come back to my question.
And I have, after you, Joe, I have Director Sorrell, who's raised her hand, so go ahead, we'll go to you and then Director Sorrell.
Yeah, I was just going to suggest that we know the number of nurses we currently have working for us, and we also know how long they've been here. It'd be interesting to look at that and chart it out, because that would be an indication of not only how many nurses we have, but how long they've worked here, and that may, to some degree, address that question. Because I understand in some previous presentations that most of the people who come to the county stay at the county. A lot of people stay here and stay for a significant amount of time. It'd be interesting to see what that is in terms of nursing.
Thank you. Chair, Director Sorrell.
Thank you so much, Acting Chair. Another question I think is interesting to review as well, too, when we talk about the percentages. Do you have information on not only our potential vacancy rates, but our comparison with our other Illinois Medical District hospital vacancy rates for their nursing staff? And are we able to obtain numbers that have comparisons given what our potential vacancy rate is versus other hospitals? Because that also is a key indicator as to whether we're doing a better job being able to grab the nurses that are coming out from school or looking to join careers, and are they coming to us rather than going to our counterparts?
Yeah, we do have resources available that can show us those comparable metrics, so we can work on making sure that we report that out so we can see exactly, compared to those benchmarks where we stand in the industry.
That will be helpful to know because it'll allow us to gauge as well, not only the things that we're doing well and that we have our elevator pitch together in terms of coming to CCH, but also a good comparison in terms of how we're doing from the regional hospitals that are along with us as well, too. Thank you so much.
I have a question also. I know Nurse Peters, right? I think they started a feeder, like there were plans to start a feeder program where there is some kind of mentorship of people that are student nurses and different internships, and hopefully that would increase the amount of people in the nursing field that then make the commitment to join us in our mission. On the other end, are we also incorporating feedback from what we're getting out of that program? Or maybe there's the opportunity to look at that and see if we're getting what we plan to get. It was in the, I think, strategic planning for the nursing.
Yeah, there may be some opportunity there. I know Karen, for instance, spoke to the graduating class, I believe, in the program that you're talking about just recently. But there's probably more opportunity there to not only partner and get the word out about our opportunities that we have been doing, but get more feedback from them on better ways to reach and attract them and why they would remain here after that fellowship.
Sam, do you have something?
Yes. Maybe a year or two ago, I asked this question about where was the true gap that occurs in the need for nurses. What I was told was this is between the tenure, a 5 to 11-year tenured nurse. That's where we seem to have a deficit. We seem to do a good job in the beginning, and the whole adage of they like to stay here, but we lose them at a certain point in time, and that's where we need that. Is that still the need?
Yeah, I mean, anecdotally, that's what we've seen, after 3 to 5 years or so. To get the exact number of where we see the largest gap, we'd have to look at. I think we do a great job of attracting new nurses, and then they may stay and, as Karen mentioned, grow into other specialty areas if they can. But a lot of times they can get other opportunities elsewhere or want to get other opportunities. Just generationally speaking, after 3 or 5 years, people are moving on to other opportunities, whether it's compensation related or just experience related after 3 or 5 years. But we can get more detail on the gap per tenure and report that out as well.
The question I have, in order to fill that gap, wherever it may happen to find itself, there's I guess at least 2 ways to come to mind. The people that you have to fill the gap, the people that you have that are matriculating through the system, if we can figure out how to make them want to stay. And of course, if it boils down to they can make more money somewhere else, okay, we're going to lose that battle. But it's not always about the money. It's about the quality of the experience, the service. And you made mention of when you bring people in, you have, for lack of better words, almost like a round robin where they can go across different disciplines, different areas of practice to get that experience. Then the next question becomes, what is the off-ramp? How do I get a chance to go into this area that I find to be exciting? So creating those avenues can be one. The other becomes a function of when we go, if we look at that age, that tenure group, the optimization that you're using here with the board, does that work for a person of that age group? Because if you ask someone me, I'd like, that doesn't faze me. But okay, I'm not that age group. I'm far past that age group. I still write on paper. So the question becomes, how do we attract the people for the gaps that are there? That definitely Generation Z. Yeah, it's full of men. But okay, 5 to 11 years, where do they fall at that age? The tail end of Generation Z? Are they more like Generation X? What are they really looking for to attract them there? So that becomes the question I'm asking. How do we fill that big gap that we have? And not necessarily asking you to provide an answer, but just giving some food for thought.
I think, Director Robinson, I think that's a great point. I think that's some of the work that we're doing. I think RJ alluded to earlier, we've had a history of doing some posting and praying. We're trying to move away from that. So LinkedIn being one method we're using, along with others that we're looking to implement in the next year or so.
Yeah, multifaceted. So even with those, the recruitment partners that we displayed, not just posting on their sites, but actually partnering and networking, attending their events, and reaching people where they are, as opposed to just sending out a mass email or in-mail on LinkedIn.
I know we have to move on, but quickly as we talk about where they are, I was formerly at an outpatient ambulatory organization, but as CMO, part of the space I held was to also assist with the process of nursing. So I'm sure you all know more than anyone, COVID changed the game for nursing, right? Now you have travel nursing, you have more nurses going to become advanced practitioners. Illinois is a state where after you practice, you can get full authority as a nurse practitioner. So we're operating post-COVID in a totally different game.
Absolutely.
You know. And so there's an article, I can try to see where I saw it. It was published last year, but I think it's apropos to this year. It's all in the perks. So if we look at what our nurses' lives look like and what kind of support, a lot of times, and as a person that came up through county's a great place, highly skilled organization, highly skilled, not published, and as well as we can be, to no fault of our own, but a highly skilled organization when it comes to medical care. And the opportunity to help in other ways. So do they have a skill? Yes. You know, do our team, our healthcare team, we have the skill. It's the other stuff. Are there perks with child care? Are there assistance with family, needs? Or if they don't have a family, what kind of assistance does that person need? What is going to be that perk is largely what's holding people at this point in time. I know also for nursing, there was talk about maybe 2 months ago, we I think approved a collaboration for remote assistance with nursing, not doing the hands-on stuff, but freeing those nurses that are hands-on on site up so they can do other things. So the charge of taking care of a patient as a healthcare, legislature changes, as the compliance, how many buttons they have to click changes, they're free to maybe focus on the major things that are going to keep our that you talk about advanced directives and with video, like yes, advanced directives were talked about with the remote, nurse. I know we talked about that, and it is again applicable to HR because there's an article. I'll try to get it. It's in the perks. What is the give? What is the get? Has been proven right now in this environment for that.
Right. If we think about that gap, if it does lie within that 5 or 10 year tenure, that's kind of prime family planning time. So I agree totally with what you're saying, to make more sense to say, hey, I want to be with this organization because I can have a life. Now, my wife and I are empty nesters now from the youngest child, and so like we get to do stuff again. We actually get a chance to pretend we're real humans. And so being able to have dependable child care is everything. If people move because of child care, you choose a school district because of child care. So I'm just adding on. I'm just icing on the cake over here. That's all.
No, all great icing, to be honest with you. Yeah, and a lot of it is promoting what we do have and offer, whether it is the paid maternal or parental leave or the tuition reimbursement, but some of it is continuing to collaborate with nursing and downtown to understand what are the possibilities that we can continue to offer all of our employees. So yeah, we'll continue on that path of both promoting and continue to collaborate to see what else is out there we can offer.
I'll just end on this question. Do staff get not sure what the term of art is in your profession, or the science of HR, but do they get like a economic statement of that represents the value of all the benefits? So most people look at compensation, and when they're pursuing other opportunities, they look at compensation. But we know that it's not just about compensation; it's about the basket of goods that a company offers an employee. And I know I've had my staff put together an economic analysis to show what's the true investment that the organization is making an individual. And you look at all the holidays and sick time, and everything has a value to it. So I'm wondering if the department or the county has done something like that in the past.
No, what I've seen, and maybe others can tell me if I've missed some of the other stuff. What I've seen is when we're electing benefits, some of that is there to show total compensation that's being provided, but not all in with all the other things.
With the benefit of your pension
Yeah.
all those pieces. I don't believe that's printed at the county level.
Yeah.
And then we can talk about, I've done that in my past life as well, where we said, hey.
Oh, you have?
Yeah, I've seen that, but we didn't have the other pieces of it.
Yeah.
I see the benefit in that. I think it's something we can talk to our partners about.
Yeah, I mean, it's worth a conversation, and maybe it doesn't fit in this culture, but it's certainly helping raise awareness or educate the staff on it's not just about compensation. There's other inherent benefits that go with the work, go with the position.
Absolutely.
So let's, if you can get back to us in a couple of months on that. I'm just curious about where that lands.
Don't underestimate the tuition and reimbursement. Given our current society and what's happened federally, that's a real major motivator.
Absolutely. Yeah.
I will say for, the nurse recruitment that we've been doing, we heavily emphasize that as well as all of the other great benefits that come. So for instance, earlier, I would say maybe August, September, we had a nursing summit where HR also participated, and we did have a breakdown of all of the benefits that a nurse would receive should they join us.
And this is where marketing, to get to your point, Chair, may come in handy, because to say it to say these are the benefits to a 22-year-old or 23-year-old doesn't say the same thing if it comes to a 57-year-old. Officer Nava told, I know I'm not healthy. I know I'm going to die. But when I was 23, 24, guess what? It wasn't a word to me. That's something that old people get.
Right.
So.
Well, it's like a residual from the conversation with finance, right? You got people that don't think they need health care.
Yep. Right.
Exactly, Director Harrington.
Right. I was surely one of them at that age.
Sure. All right, thank you. You can continue. Please continue.
So in terms of talent acquisition sourcing, the current state has been very much transactional, where we are, again, doing the post and pray and going through applications that we receive. But the future state of talent acquisition is something that we want to be more strategic and proactive. So that means looking at a variety of channels and sources that we can find top talent, engaging ideal candidates through those targeted advertisement and outreach, focusing on recruitment, branding, and marketing, and definitely, the strategic partnerships with universities and professional associations and community-based organizations. We'd also like to, start focusing on executing full recruitment life cycle from sourcing all the way through, offer and onboarding, and have a big focus on enhancing the candidate experience and streamlined recruitment processes.
What does that look like at a very high level?
For which part?
The part where you said the onboarding and also the experience, because I think this is interesting.
Yeah, it's really just looking to see how do we build a streamlined process, whether it's shortening up the time that we get back to candidates, making sure that we are keeping them, up to date with their application, and then just trying to really help facilitate the rest of the process so they have a positive experience when they are joining CCH.
I think that's excellent. I would also recommend, I'm not sure if Director Green made references, but once they come on board, they're going to have their manager, but have an HR process where you understand how's your experience going, what do you need, what would you like to see, where you're going next. Because what you're doing now in the healthcare, what we call this is engaging the client or the patient. So if you consider them to be your patient or your client and engage them all the way through, then you will actually get a lead before they get ready to want to leave, because they says, well, I want to go back to school. Well, have you looked at our process that we have? And once you finish, you can come back into this role. You create avenues for them to step off and come back in to this becomes the optimum place that I want to be a part of. I just think the approach is actually very good.
Director Robinson, I think you have a really good point. I believe the next speaker might speak a little bit about that.
Okay.
Lastly, and this actually goes right to what Karen just spoke to, this is just a visual depiction of certain phases of our recruitment process. So this is not even the entire process, but even phases of our recruitment process is very lengthy. Almost all of it is manual. So we're looking at ways, we're working in collaboration not only with our quality teams, but with budget, with nursing, with BHR, just to work to streamline processes, exploring what technology we already have that we may need to leverage to create a more efficient process, automate certain processes, utilize technology to take care of some of the transactional things so our workforce can work more strategically. But this, again, just shows, what goes into the steps to recruit someone here. The left-hand quadrant at the top is just the process of submitting and getting an RTH approved. That's how long that process is. So, again, a lot of work with the quality team to improve these processes.
So you're saying your upper left quadrant is all hand done?
Almost all of our recruitment process is manual. So again, there are tools within Taleo or ATS that we may need to look at turning on if we have the ability to help eliminate some of the manual aspect of the process. But then there's some steps that we may have opportunity to remove just going through our process improvement initiatives.
And I think, what the team has done, the recruitment team with RJ and Karen, and working on process improvement, they've worked internally with some of our folks to kind of narrow it down and say, like, at our best, how long will it take? So they've done a really good job of saying these are areas we should try to think about getting rid of, or how can we eliminate doing this because it's just waste, or how many things are actually we're doing twice or touching it 3 times.
So you work with the quality folks?
Absolutely, yeah.
Okay, this sounds good. I understand your schematics that you have here. This sounds very good, but I am shocked.
Yeah. A lot of people are when they hear our time to fill, and the question is, why does it take so long? And this is just a snapshot of why it does take so long. A lot of our processes are lengthy, they're manual. So those efforts will help reduce that time to fill, and again, goes to not only the candidate experience, but even the experience of our hiring managers, who are a lot of times frustrated with our process as well. So in conjunction with Amelia on the quality team and collaborating with others, we're trying to improve all of these processes.
I understand your reaction because it was, when I chaired this, not today, of course, but I was the permanent chair of this committee, I asked for this work stream and from two chief human officers prior to you went, and it looked a lot lengthier than this, and I thought mistakenly that it had been cleaned up quite a bit, but apparently you feel like there's more opportunity there to do so.
Yeah, there's definitely more opportunity, and I'm sure we're in a better position. I started a year and a half ago. I'm sure we're in a better position today than we were then, but there's a lot more opportunity still.
Right. That was my next question. Is how long have you both been here? So you've been here 18 months, RJ?
Yeah, a little less than 18 months.
Yep.
I think I just had my
About 4
5
or 5 months.
Yeah.
Oh, yeah.
Yeah.
Okay. That's why you both look new. Great. Welcome. Anything else? Okay, thank you.
Thank you.
Good job.
Yeah, very good job.
Very good job.
Really good work.
Sorry, I do have something.
Oh, sure.
Slide number 2, just quickly, and you don't have to, it's not, it would be interesting to see what director in slide number 2, I think it is. So we know demonstrated in literature that, we know demonstrated in literature that hospitals, specifically hospitals, function better and have better outcomes when, yes, the staff, so appreciate this, leadership also reflects the lived experience of the patient, right? So it would be interesting to see not only what staff is doing, which I love that you all put in here, thank you, but also director level, C-suite, how those lived experiences, whether they be by whatever demographic it is, reflect upon the patient population in these reports moving forward. So director level, C-suite, all the way, throughout the organization, broken up, not together. Thank you.
That's good. Thank you.
Good afternoon now. Good
Hey,
morning.
good afternoon.
Carrie Primick-Vogt, Associate Chief Human Resource Officer, and Janine Sergey is our Director of Organizational Workforce Development, and she is mostly going to be driving these slides, so I will let Janine take it away.
All right, so as organizational and workforce development, we have a huge responsibility to ensure the DNA of our culture, basically, and in everything that we do across our work streams, we got to make sure we address it from these 5 factors. And it's really cool from a talent acquisition point of view. We heard RJ and Karen speak about how do we source and then the onboarding of people into CCH. And then that's where we come in our team, because it's about getting them in. And our aspect is looking at the community workforce development. So Director Green, specific to your point, it's about how do we address some of the inequities in our past in terms of focusing on heal neighborhoods and making sure youth who've not had exposure to healthcare and what is possible from a job or career perspective, that they can have their eyes open to what is available, where and how can they study and what they can get, and so that exposure, as well as opportunity to have practical experiences within CCH as well. So one of the things that we focus on, of course, is our internships, fellowships, and externships. This doesn't include information in the nursing space or the GME space, so the clinical fellowships of the residents. These are the internships and the fellowships and externships outside of that fall within our scope. And you'll see we do it with partnerships with different institutions across the spectrum there, all the way from high school through the education system to postgraduate level. And you'll notice also there are 2 asterisks there. Those indicate 2 programs, so excited about the high school program we're doing with CPS and ACHN, where we're partnering with CPS, matching a school in a community with a clinic that is right related to them, so that the seniors who've elected to be part of a health sciences elective, a 3-year program, in their senior semester, last semester, they're going to come in and do a rotational program with us, which exposes them to every facet of operating within a clinical space, and with a whole lot of professional development around it and support, success coaching. And we looked, and we couldn't find a model like this anywhere in the United States. So that's why I get so excited about this. Because if this works, the way that we can extrapolate it out and expose more youth, even within CCH's system, is phenomenal. The students are excited, CPS are excited, the high school's excited, the clinic staff are excited. We're starting with Belmont Cragen because it's an opportunity for them to pay it forward, which is phenomenal. And then this is a model that actually we can impact youth from neighborhoods that need it across the United States if we can share this programming, if it works. And then you'll see at the physician assistant level, obviously that's going to be owned by a physician assistant area, but we will facilitate and help and support them to build up an externship program there in that area that we don't currently have. Just something interesting from yesterday, had a meeting with the University of Chicago. We have, our programs last a summer, 6 months, a year, or 9-month program. And at the University of Chicago, we've got data, they've got data, and they shared with us the fellows that they put out this year, the experience with our new programming that we put in place, have the highest satisfaction of the fellows who are here, and they're producing some incredible results. So the next piece, of course, is our pipeline apprenticeship program. This is particular to get people into jobs directly, and most of you may know about our EMTB apprenticeship program that we started with the funding, congressional funding from Senator Dick Durbin, and we had some really good results there with 17 graduates, 10, getting their national certificates. It's a tough program. Right from the get-go, an extra one on a second try, and all got job offers. What we've seen is what we need to do is provide a little bit more wraparound services for the folk who come into the program, things like behavioral health support as well, some really interesting things that we, in our 2026 program now, we can extend it to an 18-week program. And we also exploring bringing on the Black Fire Brigade to help with the tutoring. So that's going to be really exciting. Another apprenticeship program that working with Beth Baklovic in ACHN, as well as Malcolm Exxon, is a 12-week apprenticeship program. And this speaks directly to a comment that you made earlier of how do we get them in from programming into employment. We've identified that there is a problem. We have huge vacancies. We've got 58 vacancies currently for MAs. And they finish an externship with us, want to join us. However, when they finish an externship, they have to then sit for their national certificate, and it takes up to 12 weeks for them to get their certificate. In that time, because we can't hire them according to our minimum qualifications until the certificate is in place, and then we can, they can apply and we can give offers. Other healthcare systems do not have the same restrictions, and they are poaching our staff. So this is a way for us to be able to get an apprenticeship program in, which again allows them to see different types of clinics within CCH and possibilities for their employment. Plus, we give additional professional development training within that apprenticeship. So at the point where they get their certificate, we can employ them in. So if this model works, this is something we can extrapolate out to other areas as well to fill vacancies. We're working on a certification partnership with the Chicago City Colleges and looking again at the hard-to-fill places. There are a few things to speak to, and Director Green, this is direct in relation to something that you mentioned. One of the interesting things that we're looking at there is that cohorts that will be specifically focused on for CCH allowing our clinical staff to be able to be adjunct faculty to actually teach, which is something that our nursing staff have particularly asked for in terms of their career progression. So it's kind of taking it from all different facets and bringing it into play. So this is going to be a really exciting partnership that we're going to be evolving. Most of you, again, know the Providence Scholarship Fund, really exciting. It moved, we started at with 90 scholars, moved to the 91 scholars the year previously, where CCH provides funds of $1.5 million for the scholarships at the health professional level and the allied level, and the Cook County Health Foundation added $250,000 to the pot, and it allowed us to go to 106 scholars this year. So that's been phenomenal. Then one of the big requests we've been getting in is for people to get that exposure and see how healthcare works. Unfortunately, in order to keep our operations going, compliance still intact, we can't get these massive groups going through. So what we've devised is a healthcare career expo, and the departments are starting to work with us and have been amazing, collaborating, where we're going to hold 2 healthcare career expos with that CCH flavor, so that we can bring students in at the high school, college level who have not had exposure, not exposure specifically to CCH, to see what is available in a very interactive healthcare space. And we're going to build it so that it's sustainable. We can literally break it down, build it up every year without having to do the heavy lift every time. And with the 2 career expos, we are predicting we will have 300 youth that we can move through and impact next year, which is pretty cool. Then, of course, there's all the requests for shadowing, but there, again, issues around compliance and aspects. And shadowing doesn't only go for those youth who are looking to say, well, what does it look like in healthcare? Like, is there something beyond? We know a nurse, we know a doctor, but most of them, if you ask them, have no other clue. But we're also getting requests for shadowing from clinical providers, physicians, to be able to shadow within our system, which is a great way also of getting, the CCH space out there. So Dr. Hassan, Chief of Innovation and Clinical Integration, I think is the title, is working with us. I love our collaborations in CCH, where everyone gets involved. He's going to be championing this with us, and we're going to build out together the protocol and process to be able to allow that to happen in a way that is not disruptive, but really a positive experience for everyone involved. And then you spoke to the career pathways, which is really interesting, and spot on with that, because we started off with building out one career pathway currently, and in 2026, we're going to move that we will have 14 career pathways mapped out, so people can see what is possible for them within the CCH space. And everything we're doing is actually based off of data that we've collected. So one of the things we see from our exit data is that besides the fact of the highest reason that people are giving us for exiting is retirement. Second one is, in fact, for family personal reasons, and the kind of reasons have adapted from their health of themselves or their family members that they now have to give personal health care to. There's issues around childcare was another reason given, moving states of a significant other, things like that. And the next reason, which actually quite a bit lower down in reason why, but was the fact of career progression. Now, in our exit survey, some of the questions we asked give us the insight that we know that they know what is available, but they don't feel they can get it here and can get it elsewhere. And so mapping out career pathways was the obviously next step that we had to be doing. So that's what we're going to be focusing on and building. And one of the other key pieces, I know I put it there for entry-level positions, this is through the kind of conversations and our human resource business partners feeding back to us where at the entry level, we have entry-level staff who've been with us 10, 15, 20 years and see nowhere to go. They've come into one position and that's where they stick. And they don't know, could there be any possibilities? So that's where we're looking at apprenticeships, certifications, pathways that we can help in their development, that they can move into clinical spaces in their future with us, and then we can build and get in from community folk to fill the entry-level positions. So everyone sees that possibility for themselves. The other very cool thing that we're doing around our programming is building in the professional development infrastructure around everything so that our folk, right from the first day they start with us in any of these programming, get a real sense of CCH and don't feel lost in it, but also help build them so they can make better decisions with their career moving forward. And so I have two amazing staff members who've just joined a few months ago who are going to be their kind of career success coaches as well around it. And coupled with that is with the Providence Scholarship Fund, we introduced this year a 6-session group mentorship program for the scholars. And we've actually held 2 of them already with really good feedback coming back. The scholars are really appreciating the effort, realizing what it means to be part of CCH, and the staff within CCH have been phenomenal in terms of volunteering their time, either as panel speakers or facilitating the breakouts to mentor these scholars. And the 2 areas we've done is working within a safety net healthcare system, because that does give a different flavor to what a lot of them have had exposure to and are studying. And the second piece we've just done on medical career paths. So that's been tremendous. Then, of course, we've got getting them in, but how do we get them going? And I think this goes back to something, Director Robinson, that you spoke to. How do we get them excited? Because studies show us that if from the day they walk in, there is a sense of belonging that is engendered, and their experience over their first year, so onboarding is a 12-month period, we actually get a better, not only retention of an increase of 25%, but also what happens is that their experience is one that is far more positive. So that's what we've focused on. So key things that we have in orientation, we've changed it out. It is interactive. It makes them feel like they belong. And our partnerships, again, across all the areas are phenomenal to help make that happen. And all staff now go through orientation. So we've got new employee staff, all contingent staff. To date, we've had, 799 new people have been affected by orientation, 515 contingent workers. I always joke with the contingent workers that we say, hey, we're doing this so you're going to be compliant. You're going to love being with us. We're going to take away the fear of your first day, on the job. But hey, have you ever considered us as an employer, down the line that you want to transition? So we want that even to sort of lay that picture with them. And even our remote workers have to go through orientation, and we do a virtual one with them. Then the affiliate orientations, that's also been a really great development that's happened. We work together with all the different affiliates in CCH to help them frame out orientations to their world of work, because it is different depending on where you work. So CIRMAC obviously have always needed to have an orientation to their specific work environment, but we also have, now County Care has a one-day orientation of what it means with their governance and aspects that they need to understand in, the health services plan space. Actually just had a meeting with them this week. We're going to help build out self-paced modules to even understand Medicaid equity, with health services, given the current milieu and things that they can bring into their lexicon of what they can offer their new staff. CCDPH have their orientation, and we've helped build with them also some self-paced learnings and an orientation space. And now working with Keisha Barbara and that whole team with having the credentialed providers having an orientation on their second day with us as well, which is phenomenal. Nursing, of course, have their own separate ones. Inpatient does one, and outpatient does a different one as well. Another new development that we've had in is our new manager orientation. So all new leaders, no matter their level, come on a new manager orientation, which exposes them to resources, support, tools they need people who are there to help them so they can put names and faces together, that the whole human resource business partner team carry, come in and they get exposed. And I also have volunteer leaders from across the different affiliates who come in and sit on a panel for me where they answer questions for the new leaders to say their experience. Like, what's the best advice they ever received in CCH? What did they wish they would have known when they started at CCH? And we actually held one yesterday. And the mood and the enthusiasm and the positiveness and creating a network already is phenomenal. It's coming out of that. The next thing that they do, because it's a 12-month period, is that they are all then enrolled in a 1-hour virtual session that they hold with me over the 12 months. We worked it off a needs assessment. What is it that new leaders within a CCH environment are looking for, that they need help with, back with their team? So that's where the topic areas come in. And off of those topic areas, I actually focus on a particular tool that they can utilize straight away back with their teams. And then it's also a very safe forum for them to talk about opportunities that they've come across, challenges that they've come across, and they can work it through in the group with breakouts, and then with me following it, I have one-on-one sessions where needed. And then we also realized, because you're absolutely spot on earlier where you spoke to, it's not about just bringing them in within the system, but how do you make them feel like they belong within their department, their team, their role, so that they can be as productive as quickly as possible, feel like they belong, and know their way around as quickly as possible as well. So what we've created are hiring manager guides, tools and templates, conversation guides, even peer onboarding mentor guides that are generic in nature, but leaders can take it and customize it for their particular area. So they have checklists, a little bit of work on their part to start with, but then they have that tool to be able to use with every new person who comes into their space. We then also, because what are we doing? I create surveys. We use and collect data all the time, which informs me what's the next step and derivation that we need to be building. There are a lot of folk who are having a lot of difficulty doing certain things. We assume everyone who comes and works with us knows how to set up a direct deposit. They don't. And where do they go? And and we don't want people to feel incompetent. We want them to feel empowered. So what we created a fun character, and our own Leo is the voice in it. He's one of our HR liaisons, Dr. Carlos. And Dr. Carlos actually interviews different people in our system, like, how do I set up a direct deposit? How do I clock in? How do I clock out? And so it's a 2-3-minute video. So now folk, when they come in, are not only automatically enrolled in our onboarding compliance module, but also enrolled in how-to videos. They're optional. You can or you can't, you don't have to look at them if you don't want to. We have 9 of them up. And what's interesting, we have started the automation of getting everyone enrolled, but I actually backdated it. So people who've been here 3 months or more ago, I kind of put them into this learning path. Again, they don't have to use it. And we're having a 76% utilization out of the 555 folk that we've enrolled in it. And I suspect that utilization number is going to go up when it's that automatic enrollment of literally, you coming in your first week, which is a phenomenal use of tools. What we started to create now, because again, I keep in contact with the new leaders coming in, what are they looking for? And so we have 6 videos that we have. We have a different character here. Here we have Lewis, Level Up with Lewis. You can see which actor I love. I don't know if you can figure out who that is. It's Lewis, but anyway, one of the actors who based it off. Okay, so that's cool. That's Carrie over there, by the way, who's being interviewed. So that's one, and we're moving it on from there. The other piece that we saw, because again, going back to what happens with the new folk coming in. Our new folk coming in, actually, if we look at our separation figures, our first year is when we were losing. After retirement, it was first year. So that's why a lot of these efforts were put on changing out the onboarding experience. That's no longer our problem year at all. However, what we were discovering is new graduates coming in, no matter what level they are, with a certificate, you know, associate degree, whatever. When they're coming into their first job, they're struggling, and that's where some of the managers are also having some difficulties. So what we've created is a new graduate hire office hours. They are 50-minute sessions, one a month. So it's a point of engagement over their 12 months. So we can see if any problems emerge and course correct to keep people on board in a healthy, good way and a positive way. And then, of course, we built out communications, which now we're going to be able to move out, where we're going to be sending communications on people's third day when they get a CCH email, operational, 7-day, 30-day, 60-day, 90-day, 6 months, 9 months, 12 months. So they always feel there's a connection with CCH as a whole, no matter where they exist in the system. And then, of course, our life cycle surveys, another great piece is we're moving across with using Press Ganey, where I'm hoping our exit surveys, we're getting a 33% response rate. And if we look at what are the figures, what's considered, right? 40% is considered the norm and adequate, so we're below that. 50% is considered good, 60% is considered excellent. And with Press Ganey now, we're going to be able to automate. So as soon as someone gets in the system that they're leaving, it literally makes a click in the background that they will get an email immediately to fill in the survey. So we are hoping we're going to get the response rates up, get more valid data from which to work, which will be fantastic. And the other piece within the contract, we allowed another life cycle survey. So I'm just working, and I'm hoping this is going to work out. It's one that I'm asking if they can do the first half of it, which is an acclimation piece at 30-day, and the second half at 90, which again means we can do some course correction work around it. So that's getting them going, but what about getting them growing? And you spoke to something earlier about how do we attract more talent right in. CCH has an incredible history as a teaching institution.
Best in the world.
I know, and I am not sure across the whole facets of CCH that we've optimized that as an attraction tool. And because there's so many resources and things happening, it's across the spectrum of building up CCH as a learning institute, from our clinical learning to our professional and workplace learning to our leadership development to our technical learning to compliance factors. And then we'll be working with Alex Normington's team to say, how do we reframe that into a marketing tool as well? Because it's not looked at in an integrated way, you know, that it could be. So exciting. So on the leadership development side, there's been a lot of development around that. Because as you correctly say, from a leadership perspective, that's what impacts so much of what can happen. And so the C-suite did an amazing thing with looking at the competencies that a leader requires in CCH. And they ratified 7 strategic competencies. So that was the starting point. Off of those 7 strategic competencies, we broke it down at what did those competencies look like at all 6 levels of leadership. And you'll note one of those levels of leadership is actually staff members, because if you think about it, an individual contributor has to do stuff where they have skills where they can lead themselves. So it forms part of that leadership framework. And that's actually stood out. So now leaders can see, oh, that's what's expected of me at that level. And if I'm at a director level, that means I better have those competencies and all the competencies below that as well. We have 101 aligned competencies. Of those, 40 of them we identified actually impact culture, so it's kind of got to be CCH homegrown. And the other piece that we've had to build is to understand in order to create sustainability, we need to build it so that it lives long after any one of us, that the capacity is here to keep building, and people understand the way in which we do things around here, which is a basic definition of culture. Now, what those competencies do, we've broken those down into behaviors so that we've turned it into assessments. People can do self-assessment. Managers can do self-assessments of their leaders that they're managing. They can ask their direct reports for feedback on themselves, so they own their own development. And it forms the foundation on which we build the building blocks of development modules as well. Yeah.
And Janine, I don't want to break the momentum, but I do want to do a time check. So we've got to wrap at 1. So you've got about 6 minutes.
Okay.
So yes, just to get through the last 3 slides. Thank you.
Okay, thanks for that, because you know I get too excited, so I appreciate that. So off of that, we've built up development programming at the different levels. At the frontline leadership development level, it's modular in basis. It's 20 sessions. It takes place over different cohorts. We started out at 18 months. Some are doing 14 months. We currently have 150 leaders going through this program. And with the 7 cohorts that have just gone on, even in our tracking, in the 2 months where all 7 cohorts are on, we have 513 change actions that have been taking place. Doesn't matter how small. Each of those become a critical mass of a difference of behavior that's happening with their teams, with their stakeholders. And if we look at it, it's really interesting thematically. A lot more interaction with their teams, which is beautifully, it feeds back into our engagement survey of what staff are asking for. And it's also about better engagement with their stakeholders, yay. So you can kind of see those factors. And you see some of the quotes that I thought were just interesting within those themes. We've also built out at the manager level, it's on a modular basis, so you can pick and choose, things, aspects like inclusive, team building, implementing change. Everything is very practically based. Everything has a self-assessment on competencies, on behaviors, and it's all action-based as well. We have leading self-modules, anything from emotional intelligence to accountability to innovation to customer service and the like that fit within the model. We've also built out a first aid kit for managers that will continue to keep being robust around literally one-page things that empower leaders to try things with their team before asking for help from others. Some upcoming developments, direct-to-peer coaching circle, a different approach at the director level. This was a need that was assessed prior to Dr. Lawrence Smith and Dr. Dan McCormick coming in, where there was a need that chairs were asking for a program, but we'll be working very closely with them and starting a needs assessment to see how that can play out. And then the executive coaching that Wynn's going to be working with moving forward as well for the execs and C-suite level. From a learning and development model, again, we work out of the competencies and we built out a foundations of administration for our admin assistant, admin analyst, and our executive assistant staff as a foundational level with all the different skill sets that are needed. We are currently building out the next stage in that career path, which is the fundamentals of data analytics, and really exciting coming out of that. All our competency training that occurs, as well as our Microsoft training modules. There's a lot of demand for that at the moment. Everything we do a needs assessment on. Job aids that we're constantly doing. You'll see there an example that we did for Department of the Public Health. We're just finishing it off. It is done in a comic form, so we're using different media, which help people have an awareness of how to use our health atlas and what they can use it for out in the community, and then our learning management system, how to make it adult learning principles, ADA principles, and create a more robust learning resource guide. And then the final piece really is around getting connected. So from our employee assistance program, we can't pull out our data, CCH specific from Cook County, but this is an incredible benefit that Cook County has available for us and our staff, because it's for our staff as well as their family members. We have up to date this year a, It is a 4.2% utilization rate, and out of our 22,000 employees in Cook County. And that kind of fits with the norms, which is our national norms, which are around 3 to 5%. And so again, just always giving the information to our staff to know that they can get help on an emotional level, on a, if they have problems on a lifestyle level and stuff. Our critical incident group counseling, that's seen a far better utilization where we are making available group counseling, to our staff who are going through traumatic events. And if you need to know more, I've got some more figures around that. We've also framed around our one-on-one conversations and seen some incredible developments and better engagement between staff and managers when they're working through what we've developed around that piece. We do team building, workplace relations when things are not going so well. We've created an infrastructure of how to play with that one. Our OD support that we offer, and upcoming, the cultural benchmarking. And I think our area, we really privilege. I take it as a real personal privilege to take on the responsibility where we're building a strategic, integrated, and sustainable organizational and workforce development, support service, process delivery, and knowledge capital, for CCH.
Thank you. Two questions. How long have you, like the other people that came, how long have you been with the team?
So I've been in the team for 3 years, and it's only been me, and now I'm going to be having a team of 4. I'm so excited, so we're going to be able to do so much more of this.
I wanted to mention that, sorry to interrupt, that I've been here about a year, and the amount that Janine's done as a one-person team is truly incredible, right? Obviously with support from Carrie, but to put this together, to be able to have this connection with the employees, obviously the passion is there. It's amazing the amount of work she's been able to do over the last couple of years, especially this last year that I've been here.
I would just say, I know the time went out, but I wanted you to go on because I love this stuff. I used to be a teacher before I would be, and so I love this stuff, and I know this is the heart of everything. And then I would submit, I know we have to talk to Alex and different people, if this were the type of thing that I saw coming across, not the whole thing at once, because, people only are going to remember about 20% of what you say anyway, but maybe just that's a lot of content that a lot of people would be interested in, that are interested in quality of life. It's right there. So you don't even have to reinvent, like, what do we say? It's right there. So little snippets, quality of life, get Dr. Leo and Lewis or whoever up there too, but get real people too. And I guarantee you, when that, making switches like that from just the logistical side of medicine to the human side was it. The other thing, and I love this, so I know we got to wrap up. If we looked at whether or not there is a plus or minus 2 MAs that are certified in terms of patient outcome, in terms of tenure, in terms of claims, we do have to look at that, and in terms of engagement, and then bundling that up, and on the back end looking at organization and individual satisfaction in that exchange, I'm wondering if we may change some of the requirements.
So for our MAs specifically, we actually give, our minimum requirements don't require just a certification. We have alternative methods of getting into the door as well. So experience is one of them, and different types of training that we know are approved elsewhere. Like military training is also accepted. Yeah.
Any other questions?
Comment?
Yep, just one comment, and then we'll wrap.
You're correct. This is fantastic.
Thank you.
The previous chief human resource officer, I thought, did a fantastic job of trying to fill in the gaps. I mean, when she left, I was really disappointed. Given what I've seen today, I'm excited about the new chief resource officer, because I'm saying, this is stuff I would have done. I'm just saying, this is fantastic. This was a great presentation where you're trying to take the organization. This puts me in the mind of when GE was the best company in the world to work for. That's the kind of stuff that you guys in both sessions presented. This is fantastic. This makes me excited about being on this committee, to see where you're going and what you're going to do. I could give you more accolades, but I'm very excited about it, because you guys actually have you have a clue. You know what this organization needs, and you have a framework to do it in, and you have a measuring stick. So this is fantastic. And your energy level? Oh, it's fantastic. It was just great.
You should attend her orientation.
Yeah.
Might do that, actually. Janine, thank you. Carrie, thank you. That as everyone has said, an exceptional presentation, very comprehensive, very academic. So I'm interested to see more of the feedback you get from the experience as people go through and become socialized to the way the county system culture works, and are part of it and contributing to it. So thank you for the presentation. I do agree, Sam. It's been one of the better day of presentations that we've gotten in my 5 years here. So thank you to Wynn.
Yes, great job, Wynn.
And thank you to the staff.
And that's why I let them present, because they're absolutely wonderful.
But everyone in the right role, you get great results.
That's right.
Excellent. But I want to thank you because you're the top. If it was bad, I would look at you and say, what the heck are you doing? So I'm going to say thank you. Great job.
That's awesome. Okay, we're going to move to item 5. Let's see. The committee will not be going into closed session today, so if there are no other questions or matters to discuss before this committee, we can move to adjournment of the meeting. As the agenda is exhausted, I will declare the meeting as being adjourned. Thank you. Have a good weekend.
Thank you very much.